पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। वाह!
Very good evening and welcome to Breaking Views on NDTV. I am Ankit Tyagi. Now, China is seeing a massive surge of COVID-19 cases, which obviously has our government and the country also worried. With India also face the same fate. All these questions right now in everybody's mind. But there is no topic in this country which remains untouched by political blame game between the government and the principal opposition. The same happened today. A letter was written by the Health Minister Mansukh Mandavia to Rahul Gandhi and Chief Minister of Rajasthan Ashok Gehlot. In the letter, Mr. Mandavia said that there are rising number of cases. There has been a case which has been detected in Bharat Jodo Yatra, that of Himachal Pradesh Chief Minister who in fact joined the Yatra a few days back. COVID appropriate protocols should be followed as far as Yatra is concerned. He also said that if those can't be done, in the interest of the nation, in the interest of the public, so that the Bharat Jodo Yatra doesn't become a super spreader event, Rahul Gandhi may even consider postponing or cancelling the Bharat Jodo Yatra. This created a massive political furor. And this letter could have been taken in complete earnest if the health minister possibly would have sounded off other states as well and other such programs as well. Before we get into that, let's just listen into what Mansukh Mandavia, the health minister, said on this entire controversy.
कल राजस्थान के 3 एमपी ने मुझे पत्र लिखा था कि राजस्थान में भारत जोड़ो यात्रा में गए हुए कई लोगों को कोविड पॉजिटिव पाया गया है। राहुल जी को एक पत्र लिखा और एक गहलोत जी को पत्र लिखा और मैंने कहा कि भाई मुझे ऐसा पत्र मिला है और इस पत्र में मुझे बताया गया है कि उस यात्रा में भाग लिए हुए कई लोगों को कोविड पॉजिटिव पाया गया है। कोविड के संदर्भ में मुझे क्वेश्चंस कर रहे हैं, आपने ऐसी चिट्ठी नहीं लिखनी चाहिए, क्यों लिखा? मैं भारत सरकार का हेल्थ मिनिस्टर होने के नाते मेरा दायित्व है कि देश में कोविड ना फैले। हम खास लोगों को कैसे क्वेश्चन पूछ सकते? यही उसकी मानसिकता हो तो उसका तो मेरे पास कोई जवाब नहीं है।
Now remember, this briefing of the health minister was after he came out of a very important meeting, and for the first time we saw, because in the parliament also, right now there are no protocols which are in place where people are wearing masks. We'll put those visuals out for you as well. But the health minister came out and specifically only addressed questions about this letter. That is why the question is being asked whether this is politics being played on Bharat Jodo Yatra. This is exactly what the Congress has been alleging. This is what Ashok Gehlot said.
यात्रा जहाँ निकल रही है वो भी जहाँ नहीं निकल रही है उन प्रदेशों के अंदर भी, उन जिलों के अंदर भी, उन गांवों में, उन घरों में एक मैसेज मकसद का है, महंगाई का, बेरोजगारी का, और शांति प्रेम भाईचारा रहे देश के अंदर, तनाव नहीं रहे, हिंसा नहीं हो।
अब मुख्यमंत्री खुद जनता के बीच जाएंगे, मंत्री जनता के बीच सीधे पैदल,
या वो हमने तय किया है कि हर 1 महीने में 1 बार कम से कम मंत्री, विधायक, जनप्रतिनिधि कोई हो, कार्यकर्ता जा सकते हैं। तो राहुल जी का खुद का सुझाव था जाना चाहिए, हम लोगों ने तय किया हम सब जाएंगे।
That was Ashok Gehlot. Now the Congress is alleging that this is just the BJP getting nervous about thousands of people coming to Bharat Jodo Yatra. But I just want to play out, and let's just play out these visuals full frame. These 2 visuals right now, and that's why the question is being asked whether this is double standards over political yatras. One is the visual of the Bharat Jodo Yatra, where Rahul Gandhi is walking with thousands of people. The other one is Bharatiya Janata Party's Jan Akrosh Sabha. They also conducted a parallel yatra in Rajasthan, which has now culminated. And these visuals have been put out by BJP leader Satish Punia, who is the president of the Bharatiya Janata Party in Rajasthan, of thousands of people, no protocols being in fact there also of any sort of protocol being adhered to, no masks, and that's why the question whether it's selective targeting of one yatra over another. How serious is the COVID threat and what is this entire politics? We'll talk about that. Joining me on the program this evening, Dr. Rajesh Parekh is the Director of Medical Research at Slok Hospital. We'll understand from him how serious is this threat. We are also being joined by, on the show, Dr. Ajoy Kumar. He is the AICC in charge of Sikkim, Tripura, Nagaland, spokesperson of the Congress Party. Joining us this evening, we also have Mr. PKD Nambiar, political analyst who supports the Bharatiya Janata Party. Gentlemen, thank you so much for joining us. But before, in fact, I begin by asking you a few questions, I want to go across right now to Mr. P.P. Chaudhary. He is the Member of Parliament for the Bharatiya Janata Party, one of the signatory of the letter which was written to the Health Minister, which triggered this letter of war and, of course, the war of words between the Congress and the BJP. Mr. Chaudhary, thank you so much for joining us at this moment. And let me, sir, start with a few questions to you. And I want to, before ask you those questions, I once again want to play out those two visuals of the Bharat Jodo Yatra and the Jan Akrosh Yatra in Rajasthan. मैं आपसे ये समझना चाहूंगा कि कांग्रेस पार्टी ये आरोप आप पर लगा रही है कि और बीजेपी पर कि ये दोहरा राजनीति है। आपकी जो चिंता है वो भारत जोड़ो यात्रा तक सीमित हो जाती है। आप ही के राजस्थान में आप ही की पार्टी के सतीश पूनिया साहब एक जन आक्रोश रैली निकाल रहे हैं। वो लगातार फोटो ट्वीट करते हैं, हजारों लोग उनकी रैली में आ रहे हैं, ऐसा बता रहे हैं। उस रैली को भी आपने शायद चिंता थोड़ी व्यक्त की है, कहा है कि वो भी थोड़ा ध्यान बरतें या सिर्फ राहुल गांधी के लिए चिंता ज्यादा है?
देखिए, ऐसा है कि जहां रैली में अगर वहां पर इस तरह का केसेज होते तो जरूर प्रिकॉशनरी मेजर लेते हैं और स्वास्थ्य मंत्रालय भारत सरकार का इस तरह के एडवाइजरी जारी करता, लेकिन उसमें ऐसा नहीं हुआ और जो जन आक्रोश यात्रा है वो समाप्त हो चुकी हैं। लेकिन यहां पर ये यात्रा जो है जब तक 100 दिन तक चली, हमने कोई कंसर्न रेज नहीं किया। कांग्रेस की भारत जोड़ो यात्रा जो है अब जो पिछले 100 दिन से चल रही है, हमने कंसर्न रेज नहीं किया। जब इसमें हमें ये लगा कि न्यूज़पेपर से और अन्य सोर्सेज से कि कोविड पॉजिटिव उसमें काफी लोग हो सकते हैं, तो हमने ये कहा कि भाई जो भारत सरकार की एडवाइजरी है, जो कोविड गाइडलाइन है, जो कोविड प्रोटोकॉल है, उस प्रोटोकॉल के तहत मास्क, सैनिटाइजर वगैरह जो है और उसमें वैक्सीनेटेड लोग नहीं है तो वो भाग नहीं लेवे और उसके पहले यात्रा के पहले उन लोगों को आइसोलेट करें और बाद में भी आइसोलेट करें।
सर, लेकिन ये तो कौन सी प्रोटोकॉल है? क्योंकि भारत सरकार ने तो अभी आज
करने के लिए लिखा है।
आज भी जो मनसुख मंडाविया जी की मीटिंग हुई उसमें भी उन्होंने कहा कि अभी कुछ नया हम प्रोटोकॉल करने नहीं वाले। राजस्थान और बीजेपी के भी जो तमाम राज्य हैं वहां पर मास्क जो है वो मैंडेटरी है नहीं। तो ये कौन सी प्रोटोकॉल हैं जिनका उल्लंघन की आप बात कर रहे हैं? और दूसरी बात, सुखू साहब जो मुख्यमंत्री है हिमाचल प्रदेश के, उन्होंने टेस्ट कराया, वो पॉजिटिव निकले। क्यों ना मान लिया जाए कि भारतीय जनता पार्टी की जो रैली है उसमें कोई टेस्ट ही नहीं करा रहा, इसलिए पता ही नहीं चल रहा कि पॉजिटिव है या नहीं है?
नहीं, ऐसा है कि अगर किसी को बीमारी होगा तो जरूर टेस्ट कराएगा। किसी को महसूस होगा कि उसको प्रॉब्लम आ रही है, तो वहां पर कुछ ऐसी प्रॉब्लम नहीं थी। अगर ऐसी प्रॉब्लम आती तो जो प्रोटोकॉल, कोविड प्रोटोकॉल है, चाहे बीजेपी हो चाहे कांग्रेस हो, वो सब पे लागू हैं। वो किसी पक्षपातपूर्ण अपनाई नहीं जाती हैं, वो यूनिफॉर्म उसकी एप्लीकेशन है। ये सोचना कि सिर्फ इस पे कांग्रेस पे लागू होगी और बीजेपी की नहीं होगी, ये हमारी चिंता है। ये चिंता पूरे भारतवासी की चिंता है, ये कोई किसी पार्टी की चिंता नहीं है।
कांग्रेस कह रही है कि आपकी चिंता इस वजह से है क्योंकि राजस्थान में अगले साल चुनाव है और बीजेपी देख रही है कि भारत जोड़ो यात्रा में कितने सारे लोग आ रहे हैं साथ में, तो जो भीड़ है वो कोविड से ज्यादा आपको वोट लेकर परेशान कर रही है, इस वजह से आपकी चिंता बढ़ गई है।
मैं अगर इस पे जाएंगे तो बहुत लंबी बहस छिड़ेगी। वो हमारी उनके लोग यात्रा में कौन है, उनके अगर पार्टी के लोग वहां के लोकल हैं वो यात्रा में चल रहे हैं तो उस पर मैं नहीं जाना चाहता हूं। और यात्रा ये क्यों निकाल रहे हैं, क्यों नहीं निकाल रहे, इस यात्रा की कोई सिग्निफिकेंस जो जीरो है हमारे हिसाब से, कोई मतलब नहीं है। ये कंप्लीटली फेल यात्रा है, तो इससे हमें इस पे नहीं जाना है। हमें अभी जो आपने जो अभी आज का एजेंडा और विषय है, वो विषय है कि इस यात्रा से महामारी फैलने की चिंता है और चिंता ये वाजिब है क्योंकि जिस हिसाब से ऑल ऑफ सडन 2 दिन के अंदर अंदर जो पूरे विश्व में अगर जो वापस फैल रहा है और इंडिया में भी जो केसेस काफी आए हैं और काफी मौतें भी हुई हैं, बाहर भी, विदेशों में भी और इंडिया में, चाहे जापान देख लो, अमेरिका देख लो, चाइना देख लो, वहां पर बेड की जगह नहीं मिल रही है, हॉस्पिटल में जगह नहीं मिल रही है।
बिल्कुल।
तो ऑल ऑफ सडन ये अगर हुआ है, तो अगर हमने स्टेप लिया है, तो उसके बाद में भी अगर वो ये कहते हैं इसमें वो राजनीति दिखती है उनको, हमें जनता की चिंता दिखती है।
सर, मैं आज पार्लियामेंट की प्रोसीडिंग देख रहा था जिसमें आप भी दिखाई पड़ रहे थे, आप भी वहां पर थे अपने बाकी साथियों के साथ। पार्लियामेंट में भी शायद चिंता थोड़ी कम है, आपको वहां पे भी अपने साथियों से कहना चाहिए, और खुद भी मास्क कोई नहीं पहना हुआ था, तो वहां पर क्या चिंता थोड़ी कम हो जाती है?
देखिए ऐसा है कि वहां पर यात्रा का जो है जिस हिसाब से वो चल रहा, अगर पार्लियामेंट में किसी तरह का अगर होगा किसी तरह का, तो वो प्रोटोकॉल जो कोविड प्रोटोकॉल है उन पे भी लागू होगा। लेकिन क्योंकि केस डिटेक्ट नहीं हुआ वहां पर, यात्रा में जो सम्मिलित है वहां
केस डिटेक्ट होने के लिए आपने खुद कहा ना कि कोई बीमार होगा तो वो टेस्टिंग कराएगा। तो यात्रा में कोई एक व्यक्ति बीमार हुआ, उसने टेस्ट करा लिया, वो पॉजिटिव है, तो वो आइसोलेशन में चला गया। बाकी अगर कोई बीमार नहीं है तो उनके लिए अलग प्रोटोकॉल, और जो पार्लियामेंट है उसके लिए अलग प्रोटोकॉल। प्रधानमंत्री जी अभी कुछ दिन पहले गए थे, उन्होंने भी 2 दिन पहले नॉर्थ ईस्ट में एक रैली करी, वहां पर किसी ने मास्क नहीं पहना हुआ था, कोई प्रोटोकॉल नहीं था। प्रधानमंत्री जी और बाकी विपक्ष के नेता साथ में बैठ के कल लंच कर रहे थे, वहां पर किसी ने मास्क नहीं पहना हुआ था। इस वजह से आरोप लग रहा है कि ये राजनीति से प्रेरित है।
देखिए ये उसको दोनों को आप इक्वेट नहीं कर सकते। वो रैली में जब हजारों की संख्या में लोग चलते हैं, और राहुल गांधी तो मुख्यमंत्री अशोक गहलोत और उनको एक दूसरे के हक करते हैं और गले मिलते हैं, उसके बाद में मुख्यमंत्री हिमाचल में गले मिलते हैं और कई लोगों से गले मिलते हैं। जब उनको खुद को कोविड हुआ और वो गले मिल रहे हैं और वो सैकड़े लोगों में फैलने की जब आशंका है,
ठीक है,
और इस तरह का इसको आप अगर खाने को और पार्लियामेंट को इक्वेट कर रहे हैं, तो ये तो मिसमैच है।
नहीं सर, मैं तो सिर्फ इस बात को इक्वेट कर रहा हूं कि जो आपकी कंसर्न है वो बिल्कुल अच्छी कंसर्न है। जो मास्क पहनना, कम से कम आप ये तो उम्मीद करेंगे ना, हम भी आपसे उम्मीद करेंगे कि कल जब आप पार्लियामेंट जाएंगे तो आप भी मास्क पहनेंगे, बाकी सबको भी मास्क पहनने के लिए बोलेंगे, और पूनिया जी को भी बोलेंगे कि मास्क पहनिए अगर वहां पर जा रहे राजस्थान में। तो
ऐसा है कि पार्लियामेंट को जो देखने का प्रशासन का, हेल्थ मिनिस्ट्री का है, हेल्थ मिनिस्ट्री का अगर जो ही प्रोटोकॉल में अगर कोविड गाइडलाइंस अगर जहां जहां लागू करेंगे, ठीक है, वहां पर लागू होनी चाहिए। और जहां पर अगर केस डिटेक्ट हुए तो हमने कहा वहां लागू करो। अगर पार्लियामेंट में भी इस तरह का कोई केसेस वगैरह वहां वो लागू करेंगे, लेकिन पूरे देश पे ऑल ऑफ सडन सारी जगह लागू करना, तो ये कोई इसका ये आधार नहीं है कि
बिल्कुल सही बात है, बिल्कुल आधार नहीं है। भारत जोड़ो यात्रा में वडोदरा में अभी एक गुजरात के वडोदरा में अभी जो एक महिला बाहर से आई हैं, जो चाइना में इस वक्त कोविड का वेरिएंट है, वो उनको भी डिटेक्ट हुआ है। तो आपको लगता है मांडवाजिया साहब को सबसे पहले जल्दी से चिट्ठी लिख देनी चाहिए गुजरात में कि फटाफट सारी प्रोटोकॉल और बंद कर दिया जाए, वडोदरा को भी वहां पे भी रिस्ट्रिक्शंस लगा दिए जाए जैसे यात्रा में चाहते हैं वो?
देखिए ऐसा है कि उसमें कोविड प्रोटोकॉल अगर एक केस डिटेक्ट होता है उस पर बिल्कुल लागू किया है और उसको आइसोलेट किया जाता है, और उस पे उस हिसाब से कोविड प्रोटोकॉल के हिसाब से उस पर कार्रवाई होती है। अगर आप सोचते हैं कि हमारे स्वास्थ्य मंत्री जी हर एक केस के लिए चिट्ठी लिखेंगे, तो मुझे लगता है कि ये तो बहुत ही हाईली अनरीजनेबल आप बात कह रहे हैं।
बिल्कुल सही बात है सर, अनरीजनेबल हो सकती है कि जो स्वास्थ्य मंत्री है उनके पास इतना काम
नहीं,
है।
आप इंडिविजुअल केसेस में अगर
वो चिट्ठी लिखेंगे तो ये बिल्कुल सही नहीं होगा, पर एक केस पे अगर वो सिर्फ ऑपोजिशन के लीडर्स को चिट्ठी लिखेंगे तो शायद इस पे राजनीति की बात जरूर होगी।
वहां लिखी गई है
जी,
नहीं, चिट्ठी वहां लिखी गई है जहां हजारों लोग एक साथ चल रहे हैं,
ठीक है,
और उनके चलने के बाद में वहां पर उसमें संक्रमण फैला उन लोगों में,
ठीक है,
और कई लोगों में ये हमें जानकारी मिली है कि उसमें काफी लोग संक्रमित कोविड से हुए हैं
जी।
तो इस वजह से चिट्ठी लिखी। तो आप चाहते हैं
चिट्ठी हेल्थ मिनिस्टर साहब ने लिखी है आपकी कंसर्न पर, अब देखते हैं राहुल गांधी का इस पर जवाब क्या आता है। लेकिन कुल मिलाकर
लड़ी है पहली।
Okay, so that was, you just heard, in fact, Mr. Chaudhary, in fact, answering the question that we had for him. That's the big question that we are asking now, politics in disguise of protocol. Is that what is happening with this letter? Dr. Ajoy Kumar, I want to start by asking you, you heard the Member of Parliament, in fact, giving his argument on this. At least in the end, he agreed that there are thousands of people who are coming to the Bharat Jodo Yatra. But what is the problem, sir, if there is a concern by the health ministry? Because there are so many people. This could potentially turn into a super spreader event. Why is Congress calling it political?
No, because of the, first of all, Ankit, thank you. First of all, because I was hearing Mr. Chaudhary speak. It's absolutely like the theatre of the absurd. If you have the same standards. Okay, if you have the same standards, there's nobody. Why this government gets so discredited is the continuous, duplicity. Okay, they postponed the COVID lockdown by 1 week to break the MP government, Congress government in Madhya Pradesh, if you remember. The issue is whether you have a Jan Akrosh rally, whether you have a rally. Right now, the highest number of patients for COVID is in Kerala and Karnataka. And not that because there are not other patients, maybe there's more testing. But whether it's airlines, whether it's the Prime Minister addressing a rally on the 18th of December in Tripura, whether it's the Prime Minister going totally maskless for so long, the Parliament not having any standard, and this Honorable Health Minister is so committed to fight COVID that he only finds the Bharat Jodo Yatra as a problem.
Right.
Is not only obnoxious, it's unbelievably stupid. I mean, sorry, Nambiar sir, because the fact is, I'll tell you, if you have the same standards, we have no issues, honestly speaking. The duplicity and the sheer, evilness which is bordering to being absolutely what you call crass.
Okay.
I heard Mr. P.P., Member of Parliament speaking. I'll complete and there is a patient who is coming from China. They don't have the courage to stop the flights, okay, by the way. Nobody's wearing any mask in the flights. Nobody's wearing mask anywhere in the railway station. Nobody's wearing mask anywhere across. So the issue is we will respect the standards if they are applied fairly and transparently.
Okay. So these are double standards, Mr. Nambiar. Is this also, Mr. Nambiar, as the Congress says, an admission by the Bharatiya Janata Party that Rahul Gandhi's Bharat Jodo Yatra is having an impact on the ground? It is successful. That's the reason the Congress says that you are so worried that you want to stop it.
Well, Ankit, I am surprised by this, that from the last 110 days approximately, the Bharat Jodo Yatra has started from Kanyakumari and it has reached, it's crossing now the Rajasthan. Is there even a once this kind of an advisory has been given? Not even once. Health issues are a dynamic issue. It's not something like that yesterday what it was and today what it is. There is a crisis which we are expecting, and there is a crisis which is already there in China, and which we know that in China what happens, the rest of the world get to know it may be very late. Even sometimes we don't even get to know that fully information. But now we know for the fact that there is a US in many other countries are also it's spreading, and we should be ready with it. And when some people have, whether it is a BJP MPs or a Congress MPs or whomsoever had sent some kind of an information to the health minister of this country, as a responsible person sitting as the health minister of the country, if he is telling some advisory, is the health minister has told them to stop the yatra from tomorrow? Nobody has stopped anything. The only thing is that yes, they have said that yes, you are doing a yatra. And many of the inmates are, it's not just a typical rally.
But the fact is, you are absolutely right. It's great that the health minister is so concerned about the common citizens of the country, including Mr. Rahul Gandhi, who happens to be the member of the Congress party and an MP. But the fact is, Mr. Health Minister is also a member of the Bharatiya Janata Party. He knows in that same state, there is a parallel rally going on, a yatra going on of his own party. If the advisory would have gone to both, it would have looked like the health minister has a larger concern for the people, not only for his opponents.
Well, I think there is a misconception. The Jan Akrosh rally, which was happening over not from the last 1 or 2 months across Rajasthan, it already got over. There is no more any rallies happening with regard to Rajasthan Jan Akrosh rally, which you are referring to.
There was a Jan Akrosh Sabha, which was the conclusion of this rally today. Mr. Punia, your BJP president today, in fact, tweeted out pictures and videos of that. All these videos which I am playing are not mine, not been shot by NDTV. They are of the Twitter handle of Mr. Punia.
My dear Ankit, what all I am saying is that it is applicable for everyone. Is the health minister has told something that tomorrow onwards you should not be taking out the Bharat Jodo Yatra? No. Okay. What all they said that COVID protocol, that is wearing a mask. And one more thing you need to understand that except in the Bharat Jodo Yatra, there are inmates. They live in the same compartment. They have swanky compartments where they travel.
But you know,
I think it is in the
again and
interest of the
again, this is
people,
being said that
we
they
should
are
do that.
asking for protocols to be followed. Let me very quickly, gentlemen, give me a moment. Let me get in Dr. Parikh on this. Dr. Parikh, what protocols are we talking about? If I know it correctly, the government of India as of now has no protocol for any public gathering. There is no protocol for tourists and coming to any destination. The last advisory that the centre had issued was in June 2022. The centre has left it to the states to decide whether mask is mandatory or not. There are no masks which are mandatory even in flight. So which protocols are at this moment not being followed, sir?
Well, Ankit, I'm not aware of any existing protocols which make masks mandatory or social distancing mandatory. Yet, on the other hand, given the looming threat that we see across the border, given our reflection of past history, not just over the last 100 years, starting with the Spanish influenza, but even just as recently as 3 years ago, in November, December, the virus started in Wuhan, and in no time it had engulfed the world. We now have a variant which is even more sinister than the original virus. It's R0, its ability to spread is 10 compared to 5 or 6 with the Delta variant. Given that, I think it's a good idea for us to follow COVID-appropriate behavior. And if at all, I think the controversy that I just see unfolding before my eyes draws attention to the need for all of us to be cautious, mind you, not to panic, but to be cautious and to follow COVID-appropriate behavior.
Yes.
Then I think some good would have emerged out of it.
Sir, stay on with me. Dr. Ajoy Kumar, I want to understand from you, as the good doctor is telling us, that this also possibly could be a wake-up call. Like you already are in the festive chairs with a very bright and lovely sweater that I see you wearing right now, the Yatra is also taking a break. Why can't the Yatra take the break, few days before, after this advisory? Why is the Congress making a point of contention?
Look, Ankit, the issue is, it's not a question of contention. Look, we need to follow the rules across, okay? It's not that if we, first of all, I agree with Dr. Rajesh on the perspective is that it's high time that we started including if the Chinese situation, we need to be cautious. And I think Mr. Nambiar is right on that perspective. When does the government lose credibility is when it starts doing pick and choose. And that's what this problem with this government is. There's 3 BJP MPs from Rajasthan who write it. There is 3 BJP and this health minister who happens to be from Bharatiya Janata Party suddenly finds most aggrieved by the COVID situation in Mr. Rahul Gandhi's Bharat Jodo. My question is, I have just seen the videos of the Prime Minister's 18 December rally in Tripura. I've just seen the Jan Akrosh rally. So the credibility, look, please put whole standards, and I respect what you, if it was come from a reliable, upfront health minister who was genuinely concerned about the health of the people.
But Dr. Kumar, it was Mr. Rahul Gandhi who, even before the lockdown was imposed, he was talking about how serious this can be for India in 2020. So Mr. Rahul Gandhi, for the Congress standard, if he was the first one to raise the flag, shouldn't he be more responsible with what is happening around him in the Yatra?
So Ankit, the question again is, just hold it to me. Now the question is, it's like the most corrupt guy in the world preaching from a pulpit on honesty. Then you lose credibility. My question to Mr. Mandya is, he had a very good point to speak on the COVID protocol. When you lose credibility by your messaging, by these kind of actions, now Parliament is on. Parliament, everybody sits next to each other.
Yes.
So my question is look, whether we should follow the protocol. Yes, okay. If there is an advisory, we will follow it. And we will follow it. I'm not going to get into it. Mr. Jairam Ramesh has released it. And as responsible people, as a physician myself,
right,
I definitely believe we will follow it. But my good friend, Mr. Nambiar, please tell your colleagues, sir, we will follow it. But please, at least for country's sake, just have credibility of being fair to everybody.
Mr. Nambiar, it was at the height of COVID when we saw the Bengal elections campaign going on. Even at that point of time, questions were raised as far as the government's whole commitment to the COVID crisis was concerned. It was only after a lot of hue and cry the rallies were stopped. That is why the opposition says we can't trust you with what you say.
Well, Ankit, I'll go a step further. For an example, just few days ago, we had elections in Himachal, Gujarat, and even in Delhi. Is there anywhere we have even heard of talking about the COVID protocol? Even we were not even discussing about anything related to COVID. See, please understand, and I think both Dr. Ajoy and as well as another practicing doctor, they both are there on the panel. Why don't we just understand these are dynamic situations? You cannot predict. These advisories were not there till yesterday. When the situations, the professionals within the government or also in the outside the government, they are monitoring the situation. If the government is putting up an advisory, a responsible opposition party or a responsible political leader, what will they say? Well, all right, this is a very good advisory. Thank you so much. We will look after this. And
absolutely. That is what the Congress should say. But the problem is the government is monitoring only possibly the opposition party, not what is happening within their own party and the system. I'm completely out of time. I just want to give last 30 seconds to Dr. Parekh. Dr. Parekh, how worried should we be? Are we going to see a situation that we saw in the second wave? Should people, already start wearing the mask on their own? Should the government immediately step in, sir?
Oh, absolutely. We should start wearing masks. In fact, I've been wearing masks over the past 3 years. I've had numerous RT-PCRs. But that aside, yes, we should be wearing masks, maintaining distance, maintaining hand hygiene. But on the other hand, there's no reason to panic. We should also see the brighter side of all of this. We've had 2 crore vaccines being administered in the country as a mixture of naturally acquired immunity and vaccine-induced immunity, the hybrid immunity.
Right.
90% of our country is covered. So perhaps there's no reason to panic or to worry excessively. But of course, we have to be concerned and follow due processes.
Thank you so much, gentlemen, for taking the time out. I'll leave it there. Thank you so much for being with us here on Breaking Views. That's all the time that we have. News and updates continue on NDTV. Stay tuned.